want to take a step back, get to the root of what's happening, what's actually going on in their brains, their bodies, their nervous systems that are creating the behaviors, that are creating the dysregulation, that are creating the delays. We start with the brain, we image the brain, we look at our brain maps. Everything that we do is based on how that child's brain is actually functioning, how they're processing information, how their brain is regulating. And all the therapies we do are based on that. So we're
Hi, I'm Esmeralda, your career coach, mom of two, and founder of New Horizon Moms. I worked in the chemical industry for 15 years as a chemical engineer. I took my career pause in 2023, and the following year, I founded New Horizon Moms. I created New Horizon Moms to empower women professionals to build a career on their terms so they can be successful at every stage of motherhood. For parents navigating the autism diagnosis, finding the right therapy can be life-changing, and today we're talking about one approach that's giving families hope. When a child is diagnosed with autism, many families are quickly introduced to different types of therapies that can support development, communication, behavior, sensory regulation, and daily functioning. That often includes approaches that focus on speech, occupational skills, behavior, or other targeted areas, and many parents begin a long journey of learning what combination of support will help their children thrive. This topic is personal for me because I was struggling with my child's elopement behavior. While we were put on a wait list for ABA therapy, I kept looking for another therapy that could help my child. One day when I was on vacation in Orlando, Florida, I came across an ad on Instagram early one morning for BrainCamp therapy services, and that's when I knew that God had heard my prayers. Here's my family's experience at BrainCamp in Jacksonville, Florida. Dr. Chris Johnson is a doctor of chiropractic with a focus on chiropractic neuroscience and the founder of BrainCamp, a program designed to support children with ADHD, autism, developmental delays, sensory needs, and behavior challenges. Through BrainCamp, he offers an intensive, brain-based approach aimed at helping kids improve regulation, focus, and overall functioning so they can thrive at home, in school, and in daily life. His work reflects a deep commitment to helping families find hope, support, and practical solutions for children who need a different kind of care. BrainCamp offers a holistic kind of therapy option that looks at the whole child and focuses on brain-based development and individualized care. For some families, this type of approach can feel especially hopeful because it goes beyond addressing one isolated challenge and it looks to support broader growth, connection, and progress in real-life ways. Here's an example of one of the therapies that Dr. Chris offers.
Low-level laser therapy is my favorite tool to use with kids and is the most important part of our programs both in the office in our intensives and at home in your home program where you'll continue with the home laser device. It also is called transcranial photobiomodulation, which simply means using light energy to stimulate, support, and heal the brain. Because that's what laser is. It's focused light energy that uses wavelengths of red as well as infrared that are able to penetrate to the brain, directly enhancing brain function. It works in a few ways depending on the wavelengths we choose for each child. It can help with oxygenation and blood flow to the brain. It can help with reducing inflammation in the brain. And maybe most importantly, it stimulates the mitochondria, the powerhouse of the cell, to help the brain produce more energy, to help it form new connections, and enhance its neuroplasticity, which is what helps kids overcome the challenges they're facing. It helps the brain adapt, helps it become more neuroplastic, and it can be the final little push that kids need. I've seen it so many times that we've been trying in therapies, and we just need that extra little nudge. Laser can provide that by giving the brain the metabolic support that it needs. It is non-invasive. It's completely safe. It's used in a wide variety of conditions, and there is peer-reviewed clinical data for its use in autism, in anxiety, with focus issues, with brain injury, with depression, and a whole host of other issues. It is an evidence-based approach to providing support to kids with a whole variety of behavioral, developmental, and learning disabilities.
So in this interview, you're going to learn about Dr. Chris's therapies at BrainCamp, just like this one, what a family can expect, and how you can determine whether this approach may be a good fit for your child. Welcome, Chris.
It's good to be here. Thank you for having me.
Thank you, Chris, for being with us today. So first, Chris, I'd like to ask you, what inspired you to become a chiropractor and create BrainCamp?
Well, we got to go a little ways back. My story really started when I was a kid. In a lot of ways, I was a lot like the kids that I'm working with today. This is back in the 90s. We didn't know so much about it, so I was never diagnosed with anything, but I for sure was a little different and had a hard time in a lot of ways. And didn't really start to put that together until I was in my 20s, starting to study these things in chiropractic school. But things started to click. And so I just have a lot of empathy for these kids. I have at least some idea of what they're going through. And I like to think that on some level, I'm getting kids the help that nobody quite knew how to give me when I was a kid. So that's my why. But as far as my how, I went to chiropractic school expecting to be your pretty traditional chiropractor. I'm the second generation. My mom's a chiropractor. I planned to take over her practice and adjust the spine and have a typical kind of practice. And along the way, I started to get exposed to all these brain-based therapies. I got to intern and work with some kids and just immediately knew that's what I wanted to do. And so before I even finished with chiropractic school, I was already starting to take some additional courses in neurology, and I just never stopped. I graduated in 2019, and I've been in class since then, just working on the next training from functional neurology to neurofeedback, and now I'm learning hyperbaric. So that's kind of how I've put all this together. I'm just adding more and more tools to the toolkit and finding more and more ways to support these kids.
That's a wonderful story. Thank you for sharing that, Chris. So now, for a parent who is hearing about Brain Camp and for the first time, can you help explain to these parents what your program is about and what kinds of kids that you have provided help for so far?
For sure. So I work with kids all across this spectrum of developmental disorders, from autism and ADHD and dyslexia and things like that to brain injury in more severe cases. But what's common about the approach I take with all these kids is it comes back to the brain. So most of these kids in a typical model are treated like they have behavioral disorders, which they do show these behaviors. But what we don't do in traditional healthcare really is ever look at the brain. And these are brain conditions, these are neurological conditions. So we start with the brain, we image the brain, we look at our brain maps. Everything that we do is based on how that child's brain is actually functioning, how they're processing information, how their brain is regulating. And all the therapies we do are based on that. So whereas typically we just look at these kids like, they have these behaviors, we want to take a step back, get to the root of what's happening, what's actually going on in their brains, their bodies, their nervous systems that are creating the behaviors, that are creating the dysregulation, that are creating the delays.
Okay, very good. So, as you were saying, everything is based on how is the brain performing and how can you help in places where the brain is lacking something or needing something more.
Exactly. And once we've determined that, there's all sorts of ways that we can impact brain function, right? We have ways of stimulating the brain, whether that's with laser therapy or getting increased oxygen with hyperbaric or
Yeah.
training the brain to regulate with neurofeedback. But it all comes back to that individual brain and that individual child and what's going to help them the most rather than a kind of one size fits all approach where based on just the behavior, which is like the symptom, there's a certain treatment. Every child with this behavior gets this type of therapy. We want to take a step back, be a little more individualized. Every child's brain is a little different, and what every child needs is a little different.
Perfect, perfect. And Chris, on your website, you talk about intensive. So, for someone that is not aware of what an intensive is, can you explain how those work? And as you've already been alluding to, how are these intensives different than any other therapy that exists, for example, for children on the spectrum?
Yeah. So an intensive is just a lot of therapy in a short time. I work with kids in person in the office only for a week or two at a time. Um, but here's what I've found. I had a more traditional therapy practice for years where I
Mm.
saw kids once a week, maybe 2 or 3 times a week if I was lucky. And there's a lot of kids that I was able to help. But for really kids that are really impacted, profound autism, things like that,
Mhm.
it takes more than an hour once or twice or 3 times a week to really impact
Mm.
their brain. So when we do an intensive, number one, we're seeing each other every day, at least one session a day, sometimes more. We're getting a lot of stimulation of their nervous system, but we're also training the parent how to continue at home, both with exercises and regulation strategies but with laser therapy. So we provide a laser in our intensive. We train the parents on how to use it. They continue with the laser at home so that you get the best of both worlds. We get the one on one evaluation and individualized care that comes from working with a provider in person. But we also get the daily stimulation that we can really only get at home. Nobody's coming to my office every day for 3 months or 6 months on end.
Yeah.
So the only way to really get that done is to prepare parents to use these tools at home.
Yeah, that's awesome. And that's definitely been the case in our situation where, you taught us a lot while we were there with you for that week. And it was very powerful to go home and be able to continue the exact same things that you were
Mhm.
able to do in the office. And so I think as a parent, it's also empowering that not only are we, helping our child, but as a parent, we're also walking away knowing that, yes, I can continue to do something for my son. And it's not something that I'm always depending on a therapist to do, that I'm also walking away educated. So that's been very powerful for our family to be able to
Absolutely.
guide our son and to continue his journey.
Yep. And I love to hear that. And that's exactly it. As much as we can get done in the office in an intensive, I think you'd agree the real changes happen over time. And it takes
Hmm.
a lot of hard work on your part, a lot of hard work on the child's part. But if we set up that system where you can implement these things at home consistently, that's when we really start to see some change.
Exactly. And so how do you determine, Chris, what type of therapy a child would need while they're with you in the clinic? And tell us a little bit more about brain mapping and its role in coming up with your customized treatment plan.
For sure. So we do all sorts of assessments in the office from what a lot of parents are more familiar with, which is primitive reflex testing, balance, coordination, visual motor skills. We do look at all those things, but more and more as technology evolves, I'm relying on what's called brain mapping. So brain mapping is a way of measuring the activity in the brain and determining areas of weakness, areas that are underdeveloped, areas that maybe aren't communicating well in the brain. The way that it works is just like an EEG that a child might have done to look for seizure, to look for their sleep quality. So sensors are placed on the head. It's not like an MRI that uses radiation. It's just picking up signals from the brain. And child wears this little cap for a few minutes. It's measuring the activity. What makes it sort of unique is we're able to compare their brain activity with a normal database, which flags for us any little deviation any little underactivity or dysregulation, so that as opposed to just looking for epilepsy or for a big lesion in the brain, we're able to look at it just functionally, which areas are not working as efficiently, which areas are not regulating the way we can.
Mhm.
So, big picture, what that means is
Yeah.
based on our brain map, we know what parts of the brain are involved, we know what type of stimulation that brain might need. And when we use tools like our laser therapy, we're able to pinpoint exactly the areas in the brain that need that stimulation.
Yeah. Yeah, I can definitely remember when you showed us that scan and it was that aha moment of, well, no wonder that's why my child was struggling with this, or he's not been able to do these type of focus related activities. So yes, it's a very powerful tool to tell us what's going on inside the brain.
It
And
is. Much as it's valuable to us in creating the protocols, it's that just as much. It's amazing for parents to kind of have the answer and to have that validation of there is something going on in their brain. This is more than what I've been told.
yeah, that's great. And Chris, what results have you seen now having worked with so many families and so many children? What are some of the testimonials that you've heard of how this therapy has helped so many children's lives?
I've seen some pretty cool stuff. I work with lots of kids with autism and severe brain injuries, and
Mhm.
a lot of kids that no one expected a lot from, just to be frank. And I've seen some pretty remarkable transformations. I've had kids go from mostly non-speaking to speaking in sentences and communicating freely. I've had kids take their first steps in the office. So we see those kind of remarkable transformations. We don't always see that. What I can say pretty consistently is with this type of therapy, we almost always see improvement in regulation. So things like sensory processing and that sensory overwhelm a lot of these kids struggle with. Things
Mhm.
like quality of sleep, things like focus and emotional regulation. Those are changes that I pretty much expect to see. They're
Yeah.
pretty consistent. A lot of times we see changes in motor skills and our sensory skills. And we do, I think our batting average is a little better with this type of therapy than in traditional healthcare. We do see those radical transformations, although every child is different and it's impossible to guarantee a result for any particular child. But we have seen
Yes.
some pretty exceptional things with this type of work.
That's wonderful. And anything in regards to speech as well? Have you seen improvements in speech delays or improvements in that area?
Yeah, absolutely. Like I said, I've seen kids go from having just, single words here and there to
Mhm.
speaking in sentences. I've seen a lot of kids that have articulation difficulty, right? They're not speaking clearly. They have a hard time coordinating their speech. I've seen that improve many, many, many times. I've
Mhm.
seen vocal tics improve and vocal stimming and echolalia improve. And again, the speech is one of the hardest areas to predict. So I don't want to put that expectation there like we're
Yeah.
going to see that, but I have seen it many times and it is definitely
Mhm.
possible.
That's wonderful. I know that gives a lot of parents hope
Yeah,
that some of the issues that they are seeing their child struggle with today, that there is an alternative form of therapy that they can pursue and hopefully see some results or move towards that direction.
absolutely.
So, Chris, as we wrap up our conversation today, if there's a family that's interested in wanting to have a consultation with you, how can they get in touch and what's that first step to get started?
Sure. So go to our website. It's thebraincamp.com, thebraincamp.com. Our first step is a video consultation, which we don't charge for. It is free. That gives us a chance to go through the child's history, mainly to say, would they be a good candidate? Are they likely to respond? Not all children do. But if they feel like it's a good fit, if we feel like they're likely to respond, then we can look at some dates for intensives and we can go from there.
Yes, and please share with our parents where you are located and what's nice about your destination.
Yes, we are located in Jacksonville Beach, Florida, just steps from the ocean. So if you're going to go and do an intensive somewhere, it might as well be here on the beach and make it a little vacation.
Yeah, perfect. Well, thank you so much, Chris, for joining us today. And I hope this information can help another autism parent out there who is looking for a therapy that can help them understand where their child is today and if there is a chance of helping them overcome some of those challenges that they're dealing with. So thank you, Chris, for your time.
Absolutely. Thank you so much for having me on.
Here's how you can get in touch with Dr. Chris by calling 904-351-6525 through Instagram at Chris Johnson DC, through Facebook at BrainCamp, or through his website, thebraincamp.com. Stay in touch with New Horizon Moms through Instagram at esmeralda.lunaramos, through LinkedIn at New Horizon Moms, and through email, newhorizonmoms@gmail.com. If you found this information helpful, share it with another autism parent.